A number of questions on vaccinations, how quickly we can go, whether there's, the first dose needs to be followed as prescribed by a second dose fairly quickly. What does the U.S. need right now?
I think the U.S. needs to scale up the ability to get, to be honest, needles into people's arms. The vaccine manufacturing seems to be on schedule in terms of generating enough vaccine, and each week there's more and more vaccine available. What we need to now focus on, after moving away from the high priority populations, is the mass vaccination campaign. And, the Biden administration just made a few announcements that really will facilitate that. We need to make sure that people are getting their vaccine. We need to make sure that they get them on the prescribed dose, because we know the prescribed dosing will give us that 90 to 95% protection rate that will really make an impact come the fall in terms of the COVID-19 pandemic.
How critical is the J&J vaccine if it gets approved because it's one single dose?
So the caveat is we still haven't seen the clinical efficacy data, but
right.
A single dose vaccine, and especially one that doesn't have that cold chain that the Moderna and the Pfizer vaccines require, will really improve our ability to vaccinate people. That will allow us to go to more remote places. It'll allow us to set up more vaccination centers because we won't have those limitations of having those very cold -70°C freezers around to make sure that the vaccine is stored appropriately before giving it. So I'm looking forward to seeing that data, because it will dramatically improve the vaccination campaign if it's efficacious.
Andrew, I know it's difficult. You need to look at charts because you're basically competing with the number of people vaccinated, to almost counter the number of infections and the number of people that end up in hospital. Is there a magic number? Do you have to get, this many people vaccinated in this number of days to try and beat this?
Yeah, the models that are based on the older lineages, not the new variants, would suggest that somewhere in the range of 70 to 75% of the adult population needs to be vaccinated to make a really significant impact on the spread of SARS-CoV-2. I know modelers are working now to see how these new variants that may have increased transmission would play into that. But I still think that that's a great goal. 70% of the adult population, if we can do that by September, then we'll be really set to make an incredibly important impact on the spread of this virus come the next fall, winter season.
Dr. Pekosz, do we have any figures of, once you get that first Pfizer vaccine, how immune are you to it before you get the second dose?
Yeah, so the clinical trials suggest that there's an efficacy of about 50% after the first dose. The immune responses are there in a majority of people, but they're significantly lower than after the booster dose. And that's important from a virology standpoint, because we really want to get people to a high level of immunity as fast as possible. When you have a large population with moderate amounts of immunity, that's usually a recipe for the virus to be able to have variants emerge that are resistant to those antibodies. So we want to move from low immunity to high immunity as soon as possible. And I think that's what the Pfizer and Moderna vaccine schedules really allow us to do.
We saw a very different Anthony Fauci yesterday, saying he was almost relieved that now the administration trusts and listens to the scientists. Do U.S. citizens follow that and trust scientists more and get vaccinated more?
I hope so. Certainly the numbers that have been that I've seen about vaccine acceptance have been increasing lately. I think that this new administration, with a new focus on emphasizing the science, bringing the science forward, following the science, and to be honest, the leadership that reminds everybody of all the things that we're supposed to be doing to limit the spread is actually quite invigorating. And it's refreshing to see that attitude, even though it's only been a few days since the new administration has taken place. So I see a lot of good things on the future. I love the executive orders that are going out because they take care of the short, medium, and long-term needs to control this pandemic. And I think that we're now going to be moving forward into a new phase where we can really get better control of this and allow ourselves to come back to some more normal semblance of living in a few months.